Hi, my name is Dr. Morteza Farr. I'm a board-certified orthopedic surgeon. Today I'd like to talk about a new and exciting method for treatment of back pain and decompression of a spine. This is what referred to as endoscopic discectomy and laminectomy and fusion. This minimally invasive endoscopic procedure allows us to treat pathology of back, including back pain, leg pain, and spinal stenosis. The spine is made of bony segments called vertebrae that are stacked on top of each other with a disc between. The disc functions as a cushion for those segments and also allows motion. The spine is a protective cover for nerves that come from brain to our extremity. Over time, unfortunately, our disc can wear out. Several factors such as smoking, obesity, lack of physical activity, and job that requires heavy lifting can accelerate this process. As a result of this wear and tear, arthritis sets in, and bone spur formation and bone overgrowth can occur. We can also have other problems such as disc herniation and disc rupture. This bone overgrowth and bone spur will reduce the space that is available for nerves and result in compression of these nerves. We'll refer to this process as a spinal stenosis. A spinal stenosis or compression of the nerve result in a poor function of these nerves. Since nerve supply our muscle, this nerve compression results in weakness and reduced function. Since spinal stenosis occurs slowly over several years, most patients initially don't see any significant difference or they don't see any symptoms. However, as the problem progresses, most patients notice more difficulty with walking long distances or standing for a long time. When that occurs, our option is to open up the space for that nerve. This is performed by a surgery which is called laminectomy. In traditional laminectomy, a large incision, sometimes several inches, was made to gain access to the area of pathology and problem. This, of course, caused a long-term recovery with soft tissue trauma and muscle trauma. At the Regional Medical Center, we use a minimally invasive technique called endoscopic discectomy or endoscopic laminectomy. In this technique, we use a special instrumentation to gain access to a spine with minimal soft tissue trauma. Most of the time, we can make an incision that's only an inch or smaller without many rupture of the muscle or disruption of the soft tissue, and it allows us to gain access to the area of pathology, and we can perform the laminectomy and removing the bone spur and allow opening of the nerve with much shorter recovery and much less soft tissue trauma. In addition to being able to perform laminectomy and decompression, we can also perform our fusion through the same specialized instrumentation. In the case of fusion, sometimes the pathology of a spine cause instability in this segment. At that time, we need to place instrumentation, mostly screws and rod, to keep the segment stable and keep it secure. Now, with the endoscopic technique, we're able to perform this process with minimal soft tissue trauma and a small incision. In closing, the advantage of an endoscopic spine procedure in general is significant less trauma to the soft tissue, which allows much quicker recovery, less blood loss, and better functional outcome in the future.